And it's at that conference that I met Dr. Ezio, and he had read a paper and do with his drugs. I said, no problem. I take drugs from all sorts of people. If they think that it cures HIV, we will detect it. Once the HIV is no more divided, the poles will not be there. If it starts to divide and comes alive again, you will get the poles. So I said I'll try his concoction. And within a week, he sent me the first sample, and I looked at it, we gave it to some patients, and I told him he had to modify it because it wasn't really doing much. Then he got the second one, which took some time to show something magnetic in terms of destroying the virus. And told him again, you must modify because he knows what he's putting in. I don't know what he's putting in. And the third one that we worked out was absolutely fantastic. And we have treated up to date about 18 to 20 patients. With background communities, we treated over 200, 250 patients. But what was interesting was that many of these patients, after about 3, 4 weeks, 5 weeks, you find that the magnetic poles disappear. Magnetic poles which are characteristic of HIV infection. And what was also very significant was that as opposed to these very expensive drugs made overseas that cause a lot of problems to patients, we had nobody complained of anything. Had taken somebody's drug once to treat, that was the person did that about Panika. And we looked at his drug, and it was reasonable, in 3-4 weeks. We couldn't get it closed. So the man decided to bring the same drug, but it's very concentrated. That means it's not so watery. And then we tried it and found that the patient said he complained about vision, that he wasn't seeing well. And I then abandoned looking at it. But we worked with this Salvage and CANCER for about more than 2 years now. Some patients who continue to come to be tested have shown that indeed, unless they get a new infection, the cure, I mean what I say, of HIV infection. And they manifest by them feeling very well. Some gain, those who lost weight, gain their weight. And what we call ESR, erythrocyte segmentation rate, which will be high before now starts to come down. ESR is what you use to see whether there's some chronic infection in people. It's the red cells. If you have situated blood and you see that the red cells will be coming down, and you can measure after 1 hour how far it has come down. So you get a clear fluid above the testicle and or the tube, and then a red area. And in many patients with cancer, HIV, tuberculosis, and then you find that you have very high ESR. The normal is under 10 millimeters, but some people have up to 150 millimeters. That is, red cells have just gone down within 1 hour. That length, 150 millimeters. So anyway, Sometime in January this year, while I was overseas, and they wanted to get this into internet, what he was doing. So we had to, myself and Dr. Oz Gladys, who is senior lecturer in medicine at NU, and works with me in this AIDS thing, and is also a consultant dermatologist, So we analyzed the cases we gave Salvage A and Salvage B. And in the thing which I have given you, unfortunately it's not paid, but you will see in one of these papers the report which we send down to the United States. And I just read it out. It said over 14 patients were given the drug, 5 of whom have been followed for over 12 months. The patients had positive serotype for HIV infection and also had biomagnetic dipoles for HIV infection. Their ages range from 16 to 47 years, and their commonest complaints were lassitude, that is, you're feeling tired and feeling well, intermittent fever, frequent stools, weak up and down the gut. 2 of those patients had what we call herpes zoster. It's another virus infection, varicella virus, which is the same virus that causes chickenpox. But in some people, it will cause a very big bullous rash with redness in some part of the body. And it takes quite some time to heal, quite painful. And 2 of these patients had recurrent herpes zoster. We had, of these 14 patients, 2 of them died while they were under treatment. And they died within 3 months of starting drug therapy. 1 died from severe hepatitis, that means that the liver was in trouble. And that patient also had influenza, incidentally. And the other patient, a man, who came from Suka, died from severe amoebiasis. You know, amoeba invaded the whole of the gastrointestinal intestine and was very, he died from this severe amoebiasis and terminal pneumonia. It took 2 to 6 weeks. Average was 3.3 weeks. That means they come to see me or see me with Dr. Arthur every week, and we test them to see if the dipoles, magnetic poles, are still there. And it took from 2 to 6 weeks for the dipoles to disappear. On the average, it's about 3.3 depolarization for the magnetic dipole for HIV will disappear, indicating the time it took the drug to stop the virus dividing.
This research occurred in the pre-antiretroviral drug in Enugu and generally in Nigeria. Actually, the research was carried out at the pre-antiretroviral drug introduction into the system in Nigeria. At that point in time, HIV seropositive patients were just roaming around looking for something to be done for them. There was no treatment, and a lot of them had skin problems, which is part of the disease. And there were so many in our clinic. In fact, we were overwhelmed. And Professor Onagluchi, the late Professor Onagluchi, who is or was interested in alternative medicine, he was a professor of pharmacology and then a physician, was also interested in finding out ways to help these people. Then, as we were managing them, Dr. Chid brought Salvage A and B into the clinic, and we gave them to the patients, and a lot of them gained weight. Their ESR, which used to be very high, came down. Even their skin problems regressed. And you know, we have a problem following up these patients. Some of them, when they get better, they disappear from the clinic. But those we were able to follow up, out of about 10 of them, 2 became seronegative in 2003.
Have you also had a seroconversion? I mean, HIV/AIDS patients turning seronegative from seropositive using any other means apart from using Salvage A and Salvage B?
Yes, because we are comparing Salvage A and B with biomagnetic therapy. And from that also we had a few seroconversion. But the problem was, it was so tedious. You have to follow these patients off for so long, and the treatment was a bit more laborious than just giving them Salvage A and B, telling them what to do and how to take them, and then reviewing them 2 weekly. Right. This one you have to be doing almost every week. And
thank you so much. Well,
my name is Dr. Chidi. I'm a research doctor from Africa. I've been working on HIV patients for over a period of since 1999. That's over 7 years. It's over 8 years now. But I've been researching on natural supplement for over a period of 25 years. I came from the family of people that know about medicinal herbs, and fortunately for me also, I went to read medicine at the University of Nigeria in Soka, where I have worked extensively on HIV and other chronic infections, other chronic tropical diseases. I've worked with Professor Naglochi of the blessed memory and the current consultant in University of Nigeria Teaching Hospital, Dr. Mrs. Ozo. And right now we have with me here, this is Denario. He's an American, he's a male. You can see Denario has lost a lot of fluid in his body, and you can see his skin toggle, what it is like, and a lot of rashes in his legs, and you can see the way he has grown asthenic. I'm not afraid of touching HIV patients because you have to give them support, you have to morally support them, and I know you cannot get the disease by just touching them. They need a lot of love, and I am very, very confident that Salvage A and Salvage B herbal supplement is going to help him. So this is the beginning of this treatment on this particular patient. We have had a lot of similar cases and even worse cases in Africa, where we have, in addition to the HIV positive patients, they also have the problem of malaria infestation, in addition to the problem of poor diet that people have in Africa. But by and large, I believe that American patients, they should be better well treated with Salvage A and Salvage B, because we are only battling with HIV in the blood here. We don't have the concomitant problem of malaria parasite, as well as the problem of inability to afford nutritious diet. So we are praying that God will help us with Denario, and in a couple of months he's going to be looking healthy. But we will continue the treatment for at least over a period of 1 year.
My name is Denario Redden.
I'm an American.
And I'm an American.
I was diagnosed with HIV.
And I was diagnosed with HIV.
What hospital?
Grady.
Okay. Are you having diarrhea now?
I'm not having diarrhea.
Okay. You have lost some weight?
Well, my weight still is, so I gained a little bit.
Okay. Okay, then we let you use this herbal supplement, Salvage A and Salvage B. It's going to help you a lot in your condition. Are you already using that product now? Today is November the 3rd, 2007. Are you using those products?
Yes, I am.
Okay. And we are hoping that it's going to... Are you strong since this started? Are you able to do a lot of work?
I'm weak a little bit. I can't do that much walking.
Okay. Okay, and do you have a lot of appetite to eat your food? You don't eat as much food as you want to?
Well, I eat.
Do you eat
Yeah,
the way
I eat
you used to?
more than I used to.
Yes. You eat more than you used to?
Yes.
Oh, really? Now I noticed the rashes on his legs about a month ago. He probably have lost some fluid. His skin toggle shows that of somebody that has lost some fluid. And his thigh, he has lost some weight and some conformity. Since you are taking this Salvage A and Salvage B, we hope with God's grace that it will help you like the way it has helped other HIV patients in Africa. So it's all herbal products that are natural, but it has helped a lot of people, and we hope that it's going to help you as well. Alright?
Yes.
I will tell everybody about this product, Salvage A and Salvage B for HIV positive people. And I know God gonna heal him through this medication. I'm not gonna say if, I'm gonna say God gonna heal him through this medication, because I know Jesus is a healer.
Hello viewers, this is Dr. Chidi Ezio. We are in the United States of America. I'm a doctor, a trained medical professional from University of Nigeria in Soka. I have been in the US for the past 7 years. I am a research doctor working on natural products, especially the medicinal products from West Africa. Among the things we have been doing is using Salvage A and B to treat HIV patients and some cancer patients. Today with me is Lenario Reading, a HIV patient diagnosed here in the United States of America. He's been with HIV for the past 15 years. By the time I met him, November 2007, he was already a full-blown HIV patient. And I'm going to introduce Lenario Reading. Let him tell us when he was diagnosed with HIV, what he has taken since he was diagnosed. So, Lenario, how are you doing today?
Well, I'm doing just fine. Like, my body's like 85% now.
Okay, 85%,
Yeah.
you're feeling good.
Yes.
You were diagnosed in 95?
In 95.
1995. Now, since you were diagnosed, have you taken any other medication for your HIV?
I had never took HIV medicine at all.
Why did you not take it? I know we met 2007. Why didn't you take any HIV pill?
Because I was scared of the side effects, how they had people looking and, dying, and I just was scared of the medicine, didn't take it.
Okay. Because of the side effects and how people taking it are looking, you didn't want to take it.
Yes.
When we started back in 2007 with Lenario Reading, there were a lot of problems with him. His skin conditions were very poor, as we can show you in the previous video we had of his skin lesions. I mean, there were a lot of lesions in his skin. Most of them were pustular, and he was very dehydrated, and you can pull the skin turgor was very poor. It was very elastic when you pull the skin, as you see in that particular video. And Lenario couldn't even talk to us. He was lying down in bed. Lenario, am I telling the truth?
Yes, sir. You're telling the truth.
Okay. Lenario was very, very weak. He could hardly tell us what was his problem because of the level of lethargy and weakness that he had. And we started treating him, and by the time, one thing I told him is that I said, Lenario, when you start taking Salvage A and Salvage B, after a couple of weeks, you are going to be looking like somebody who doesn't have it. Please don't quit taking it. Make sure you are on this product steady. Yes, like when we started treating Lenario Reading back in November 2007, his skin was very poor, very pustular. There was a lot of eruptions in his skin, and most markedly was the level of weakness and the level of coughing.
Well, I was coughing a lot, coughing up yellow stuff, just mainly coughing, from the HIV. I was real sick. I just couldn't move. I was weighing like 80-some pounds.
Were you having diarrhea?
I was having diarrhea real bad.
Okay.
I couldn't eat nothing.
Okay, you were weighing 87 pounds. How much were you weighing then? Can you remember how much you were weighing?
I was weighing like 86, 87 pounds.
86, 87 pounds. How much are you weighing now?
What I'm weighing now, about 135.
You are weighing 135 now.
Yes.
And you have been taking Salvage A and Salvage B.
Yes.
Okay, let me ask you a question. Where do you go to get if you go to hospital to get HIV medication which you are not taking? When you go there, what do they say about you? What do the doctors say about you? And what do the patients say about you?
Well, they tell me that I look different. My skin look beautiful.
Okay.
I don't look like the same person when I first came.
Okay. They tell you don't look like the same person when you first came.
Yes.
Okay. And we know now you're not taking the HIV medications because you are taking the Salvage A and Salvage B. What do other patients tell you? You are a doctor? Or do you tell them about Salvage A and Salvage B?
No, not really. They just look at me like they see something different.
They see something different.
Yes.
And they have not really cared to ask you what are you doing different.
No.
So what I tell patients, especially when they come in full-blown cases, advanced cases, I tell them, look, when you start taking Salvage B, which is the most important product we have in this regard, when you start taking Salvage B, expect one thing to happen and don't be afraid. When you go to the bathroom, a time will come when you will begin to pass whitish stuff coming out from your body, and once that happens, I'll tell you that your body, the surface of your intestine where you have digestive enzyme and absorptive surfaces, the villi in the body, will be exposed, and that time you begin to get the benefit of the food you eat, and after some time the diarrhea is going to be subsiding. So in the case of Lenario, I want him to tell you whether he did have that experience of passing whitish material or not. Lenario, I'm now asking you, when you started taking our medication, was there a time, how long did it take you in 2007 before you started noticing whitish material passing from your body when you go to the bathroom?
It was about a week after I started taking the medicine.
Okay.
The Salvage B.
Okay. And how heavy was that?
It was real heavy at first.
Were you afraid?
No.
Were you afraid when it started coming out?
No, not really. It shocked me, because you had already had told me that it was gonna come out.
Okay, shocked you that that quantity of stuff was coming out. You were passing out that quantity of stuff.
Yes.
Because this is not like physics. It's not like but this is different. Something you never know is in your body coming out.
Yes.